Alright, so today we have a basic IV insertion on this patient today. It is for Mr. Jones, and according to the doctor's order, it is an 18 gauge calf. So we're going to go ahead and check the doctor's orders, make sure it's the right patient and everything. We're going to go ahead and gather all of our supplies here. We have the tourniquet, this is a normal pre-filled syringe of saline. This is our extension tubing. We have tape. This is to label the calf. We have alcohol swabs, gloves, and a stylet. So we're going to go ahead and knock on the patient's door.
Hello.
Hi, how are you doing today? We're going to go ahead and perform hand hygiene. My name is Eric, and I'm going to be your nurse today. Could you just please verify your name and date of birth for me?
Alex Rodriguez.
Awesome. Mr. Jones, that's awesome. So then, do you have any known allergies at all?
No known allergies.
Okay, good, good. So we're going to go ahead and verify the doctor's orders one more time to make sure it's the right patient. And have you had an IV insertion before? Alright.
Yes.
Awesome, awesome. We're going to go ahead and do that today, so you know it's just a little bit of a slight stick. So I'm going to go ahead and put my doctor's orders down to verify. So when you're looking at the arm, you want to pick a site that is the most distal. You want to also pick a site that is possibly on the non-dominant hand, and then somewhere that will not affect the activities of daily living. You're going to go ahead and feel for a vein that's nice and spongy. And then, do you feel any pain or tenderness there?
No.
Alright, awesome, awesome. So that's all good and done. And then we're going to go ahead and prime the extension tubing. This is still sterile. Everything in this bag is sterile also. Take this out. I'm going to go ahead and connect this. I'm just going to prime it with a little bit of saline. Okay, so a little bit of a drip. I'm going to go ahead and clamp this back up. Put that there, put this away. So, I'm going to go ahead and check for his radial pulse, which is good. Alright, so I'm going to go ahead and apply his tourniquet 4 to 6 inches above the site. Thank you. Nice and over. And then just tuck it in right there. That's good. So we're going to feel the site again. That's good. So I'm going to go ahead and apply my gloves after I perform hand hygiene. So I'm going to go ahead and check the radial pulse one more time. It's good. So I'm going to take the alcohol swab, open that up, go ahead and cleanse the site. This is 70% alcohol in a circular motion. I'm going to go ahead and let that dry out for a second. This is good. I'm going to go ahead and take my stylet out. I'm going to tell the patient you are going to feel just a slight stick. I'm going to pull the skin taut and insert with the bevel up at a 15-degree angle. On 3, you're going to feel a stick. 1, 2, 3. I'm going to insert 15 inches. I'm going to observe her flashback. I see a little bit of flashback, so I'm going to release the tourniquet. I'm going to advance the hub. I'm going to pull the needle out and advance the hub just a few inches until it is all the way through. I'm going to put my pressure right there, 1 inch above the site. Pull this out, and I'm going to go ahead and take the cover off of that, and I'm going to go ahead and connect the tubing. I'm going to go ahead and unclamp this. And I'm going to aspirate. So I do see blood return. I'm going to go ahead and do the push-stop method with 0.5 milliliter at a time. Push, stop, push, stop, push, stop. I'm going to apply positive pressure while clamping the site. That's good. So I'm going to go ahead and unhook my syringe, dispose of that. And I would dispose of the needle and the sharps after I'm done with that also. I would go ahead and apply this over the site, which I would label with the date, initials, the gauge, and the time. Then I'm going to go ahead and take my tape. And I'm going to go ahead and put it in a horseshoe. Just like that. And then I would now go ahead and document the IV insertion. I would label it with the date, the time, the size of the catheter, the site of the IV, and how the patient took it. And I would also document my patient teaching, and I would note any signs of phlebitis, inflammation, or any redness or edema around the site. And that would be it.